Hello everyone, welcome back to Chinmoy's Biology channel to yet another new episode of hemophilia. So in the previous class we have already spoken about the pedigree analysis. We have spoken about the X-linked recessive disorder. We have also spoken about some autosomal recessive disorders. So after that we have told you in a class about color blindness. So hope you have gone through all those videos. If you have not yet gone through those videos, I'll be putting the link in the description box. Please go through it, because if you are going through those videos, it will be easier for you to learn today's hemophilia. So let's get started without further delay. So first we should know that what is hemophilia. So hemophilia, as it is a genetic disorder, right? So it is actually what is happening there. The blood does not clot properly due to the absence or deficiency of certain clotting factors. Okay, so what are the clotting factors which are affected? We will read in the coming slides. So this leads to prolonged bleeding even when minor injuries are there, and it is a lifelong condition. It cannot be actually like after 10 years of age it will get cured, after 15 years it will get cured. It's not like that. It's a condition which is a lifelong condition, and it primarily affects the males as it is a X-linked recessive disorder. So why it is affecting the male? Because the male is having only one X and one Y, but the female is having two X's. So if hemophilia is present in one of this chromosomes, it will be a carrier. It will not be the affected female, right? So the other one will be masking the carrier chromosome one. So the effects of this carrier will not be shown in that generation. Whereas if this X is carrying hemophilia in the male, what will happen? It will cause the that disease to be the prominent one, and the male will be affected with this hemophilia disease. Okay, so what is happening? We are telling in case of minor injuries. So if a person is generally he is getting a cut in hemophilia, so this cut will constantly bleed like this. The bleeding will not stop. So here a slight cut in head will cause severe bleeding. Here the joints, if it is having severe hemophilia, the joints will have internal bleeding. Now you can say the nose will bleed automatically without any cause or reason. Nose bleeding will be there. So there are several things which will affect a person if he is having hemophilia. So we have told here that XX in female, if one of the chromosomes is having hemophilia gene, it will not be affecting the female because the other one will be masking this, and this will not be a prominent disorder in the female. But whereas in X, if there is hemophilia gene, then it will affect the male, and the male will also always be the sufferer mostly of hemophilia. So we will see how and what are the things which are caused in hemophilia. So let us move on to the next part. Now in this diagram we can understand a bit about how the disease is happening. Now in normal blood vessel we can say that when the blood vessel is damaged, the blood starts bleeding, but in there is an inability to form the clots, that is coagulation of the blood is not happening here because of the faulty or the absence of those clotting factors. So clotting factors, they are not present in certain genes. So for that only normal, we can say that normal clotting has not formed there. So generally three types of clotting factors are absent. So that we will see in the next slide. What are the clotting factors and how they are affecting this blood clot. But normally the blood, when the bleeding starts, the blood should get clotted. So see what is happening here. The normal vessel, the bleeding starts here. So hemophilia, incomplete fibrin clot and continued bleeding. It will continue to bleed because the clot or the fibrin clot formation has not formed properly. So there will be the bleeding, continuous bleeding will continue. But in case of normal, it will the fibrin clot is complete and it is blocking this blood vessel passage, and the bleeding has stopped. So in normal case the bleeding will stop as the fibrin clot will plug the mouth of the injury. So the bleeding will stop. So injury has been plugged here with this fibrin clot. So fibrin clot will plug the mouth of the blood vessel, and this clot formation is not happening in hemophilia patients because of the clotting factors are not present. So what are the clotting factors and how they are affecting the clotting of the blood, we should learn in this video. So for that you need to stay tuned till the end of this video. Please don't skip out and wait till the end and watch what is happening. Now we come here to the types of hemophilia. So there are mainly 13 clotting factors of blood, and the deficiency of certain factors are causing hemophilia. So that is the fact what is happening. So let us first move on to hemophilia A, which is also called classic hemophilia. It is caused by the deficiency of factor 8. Now more common than hemophilia B. So it is the mostly common type of hemophilia which is happening in humans. So it is present in 80 to 85% of the hemophilia cases. Next comes hemophilia B, which is also called the Christmas disease. So why it is called so Christmas disease? Because this factor 9 whose deficiency is causing this type of hemophilia, that is hemophilia B, this factor is called the Christmas factor. Okay, so this factor is called the Christmas factor. Why? Because it was named after the individual on which this factor was discovered. So on the basis of discovery, as this factor is called the Christmas factor, this disease is also called the Christmas disease. Is it clear to all of you? Now why, you can get a question, why is hemophilia B also called the Christmas disease? Because it is caused by the deficiency of factor 9, which is also called the Christmas factor, and it was named after on the person on which this factor 9 was discovered. Right. So less common than hemophilia A, and it accounts for 15 to 20% of the hemophilia cases. So these are the prime two types of hemophilia which are generally occurring. But there is hemophilia C also, which is a rare type of hemophilia. So it is caused by the deficiency of factor 11 and less severe compared to factor A and B. It is less severe compared to A and B, and it affects both males and females equally. So these are the types of hemophilia, and on which basis this hemophilia has been classified and what are the deficiency factors in this we have discussed. I think it is all clear. Now in the next part we will discuss more about this. So let us move on. Now we move on to the genetic basis of hemophilia. So we have already told that it is an X-linked recessive disorder. So it means that it is the gene responsible for hemophilia is always the X chromosome. So it is X-linked recessive disorder, right? So since males have only one X chromosome, XY, if they inherit a defective gene, they develop hemophilia. Okay, so it is always this gene is present on X chromosome. So male is having only one X chromosome. So if they are inheriting this only defective, then they will develop hemophilia. Whereas female, when it comes to female, they are having two X chromosomes. So even if one X chromosome has a defective gene, suppose if one X chromosome is having a defective gene, the other X chromosome is normal. So it can compensate this chromosome which is having a defective gene. So this makes the female always the carriers, but these carriers are usually not affected. So what they do, these carrier females, they will carry on to the next generation, where if they are getting sons, might be they will be affected. So if the son is getting this affected chromosome from mother and Y chromosome from father, this male person, his son, will be affected, whereas the female will not be affected, the daughter will be unaffected only. Okay, so they will always be a carrier only. So the carrier mother has 50% chance of passing the defective gene to her sons who will have hemophilia, whereas the son cannot inherit hemophilia from his father because he gets Y chromosome from father, and a hemophilic father cannot pass hemophilia to his sons, but all his daughters will be carriers. So how this is happening, we will see in the next slide. Now here we are going to take three case studies. What will happen if the mother is a carrier and the father is a we can say is a normal one. So it's not hemophilic. So mother is a carrier, father is a normal one. So we are doing here Punnett square, right? So Punnett square we have already done in Mendel, right? Punnett square, what we will see, we are doing the cross. After the cross, what we are seeing, the one female is carrier, the male is having the X chromosome from the mother, and so the male will be affected, right? So male is affected here with hemophilia, and one female and one male is not affected. So one chromosome in this male has come from the mother, but it is the non-affected one, right? So in this Punnett square we can see two are non-affected, one daughter is carrier and one male is affected fully with hemophilia. So this is the case when the mother is a carrier and father is normal. Okay, now we are telling that mother is normal and father is affected with hemophilia. So now what is happening? Now when we are doing that same thing in the Punnett square, I know it is very clear to you all when we are putting it in Punnett square, then XXH, XY, XXH and XY. So two males are normal because they are getting the Y chromosome from father. They are not getting the X chromosome from father. And the father is affected in the X chromosome because it is an X-linked recessive disorder. So this X chromosome of father will go to only daughters. So here both the daughters have become carrier. So both the daughters, if two daughters are there, they are carriers, but they are not affected, and males, both the sons are unaffected and they are all normal. Is it clear to you all? Now we will move on to the third case, which is very rare though. There both the female is a carrier and the male is affected. So what is happening there? We can see one female has become fully affected there. So when two recessives are present in two chromosomes, that means that it has become dominant and it is affecting the female now. So the female is not carrier here, the female is the affected female here. One male is affected here, fully affected, as it is an X-linked recessive disorder. So it is an X chromosome and it is affected male. And here one female is carrier here because here the one chromosome is unaffected and one chromosome is affected. So this chromosome can mask the effect of this one. But here no chance of masking because both the chromosomes are affected. And next comes the XY. So this is the normal son. This is affected son. This is affected daughter. And this one is a carrier daughter. Is it clear? So we have done 3 case studies here. And we are very clear about what is happening if both are affected, if mother is normal, father is affected, and if father is normal and mother is a carrier. So 3 case studies, just understand them properly, then you can solve any type of problems which are being given in your NEET exam, any other pre-medical exams, as well as your board exams. So now we will move on to the next part. So let us talk a bit about the history of hemophilia. So hemophilia, it is also called a royal disease. So why it is called so, or named so, hemophilia is called a royal disease? Why? Because hemophilia is frequently an inherited disorder running throughout the royal families in England, Russia, Spain and Germany in 19th and 20th centuries. So it was happening in the royal families only in 19th and 20th century. So there is a belief that Queen Victoria of England was a female carrier of what is termed as the royal disease. In truth, hemophilia B factor or factor 9 deficiency was there in Queen Victoria. Now 3 of her 9 children inherited the disorder and with her son Leopold, who died at the age of 30 after a fall that caused uncontrollable bleeding. So till now we have studied a lot about hemophilia in this class. We know that if clotting factor is deficient, the blood clot or the fibrin will not form and the continuous bleeding will happen, which can lead to death as well. So that what happened in Leopold as he was affected. So mother was a carrier, but out of his 9 children, 3 were affected, out of which 2 daughters were carrier and Leopold was affected son who died at the age of 30. But again, her daughters were married to the royal families of Russia, Spain, and Germany, where it spread like the daughters gave birth to sons who were affected. And two of them were so young that one died at the age of 2 and the other one died at the age of 4 due to minor fall during playing. So it is natural for the kids to play, to fall, to have a get hurt and all. So that is what happened. So Victoria's daughter Alice, she passed it on to her daughter Alex. She was a career in this hemophilia as well, and who married Tsar Nicholas of Russia. So that like this it continued through different royal families, and their son Alexei inherited hemophilia. So which prompted Nicholas, that is his father, Tsar Nicholas. She was married to Tsar Nicholas, right? So his father hired a Siberian monk to heal his son. But this was it was not a good decision actually, but like this only it continued in this Russian families. And next, Victoria's daughter Beatrice, she passed the gene to several of her children. For 3 generations following Victoria, hemophilia appeared to be in various European families into which her children were married, and eventually all of a sudden this disease disappeared from royal family. So might be the gene got mutated and everything was back to normal, and from royal families it was just vanished like anything after 3 or 4 generations. So how this we will see the pedigree analysis of this hemophilia in this Victoria's family. Now, in this pedigree analysis, we have told that this is a normal, these are the normal and these are carriers. So, out of the 9 children, we can see Beatrice, Alice, they are carrier daughters, and Leopold is affected, right? So, he is having hemophilia. So, Leopold, we told he died at the age of 30. Now, Alice was married to Louis IV, and she also had 2 carriers, and one male Alex, her daughter carrier Alex, was again married to Tsar Nicholas. Just now we have told. So they also had Alexis. The male was affected and others were not affected. Only one son was affected and others were normal female. So all were normal female and one was affected. Here when we come to Leopold, only one daughter was a carrier, and again she was married to a normal man, and they gave birth to one affected male child. Now again here Beatrice, she also had 2 affected male, and like that it continued. But after this 3 generations, you can see that this hemophilia has vanished and they didn't continue with this hemophilia. So this was obviously a certain thing which should have been continued in generation after generation, but in 3rd generation it vanished. So after Queen Victoria, first, second and third generation they had, but in 4th, 5th and 6th generation and 7th generation we are not seeing any cases of hemophilia carrier and hemophilia affected persons. So they are all normal, and gradually this became normal in their family. So this is the pedigree analysis of hemophilia in Queen Victoria's family, and that is why it is called a royal disease. Now we will see what are the things we can do to cure this hemophilia. Now, what are the symptoms of hemophilia? Symptoms, they depend on the severity of the clotting factor deficiency. Now, mild hemophilia, that is when 5 to 40% of the normal clotting factor levels are working. So, then what we can say, that excessive bleeding after surgery, injury or dental work will happen. Rare spontaneous bleeding will happen. So after surgery the bleeding will take a lot of time to clot. After any injury, after any dental work, because only 5 to 40% of the normal clotting factors are working. Now in moderate hemophilia, only 1 to 5% of the normal clotting factors are working. That is, frequent bleeding will happen in internal joints, as well as muscles bleeding will happen. Frequent bleeding after minor injuries will happen. Okay, so that is moderate hemophilia. And then comes severe hemophilia, when less than 1% of normal clotting factors are only working. So that is internal bleeding in joints. Here we can say that hemarthrosis, that is in joint pains there is we can say that blood loss will be causing the internal parts of the joints and muscles to pain a lot. That is called hemarthrosis. Muscles and organs will have internal bleeding, pain and swelling due to joint bleeding. So joint bleeding will happen internally, and pain and swelling will happen due to joint bleeding. And uncontrolled bleeding can also be life threatening. So these are the symptoms of hemophilia: mild, moderate and severe. Okay. Now, what are the complications of hemophilia? Generally, joint damage. Just now we have told hemoarthrosis. It is also called hemophilic arthropathy. That is, repeated joint bleeding can cause arthritis and disability. Internal bleeding, that is bleeding in organs like brain, can be fatal. Blood-borne infections. In the past, we can say that hemophilia patients were at a risk of infections like HIV and hepatitis. So, because the blood was being transfused to hemophilic patient for those clotting factors, to get those clotting factors, when blood was being transfused to these hemophilic patients, then what happened? They were infected through these blood-borne infections like hepatitis and HIV. But the modern screenings during transfusion has minimized this risk of contamination from these infections like HIV and hepatitis. Then what happened? Development of inhibitors. Some patients develop antibody against clotting factor treatments. So they patient generally in their body, they start developing antibodies, and it makes the treatment ineffective. Right, so it makes the this treatment always ineffective. When antibodies start arising in their body, then this hemophilia treatment becomes ineffective. So what are all the treatments which are done in this hemophilia? Let us see that. So, how the diagnosis of hemophilia is done? The family history analysis, we will see, check the family history whether there are any patients of this severe bleeding or this tendency of bleeding in their family. Then we can find out whether they are hemophilic or not. Then blood clotting test, clotting time test, PT, APT, prolonged in hemophilia. So this clotting time can be tested. Measure levels of factor 8 and 9 to determine the type and severity. They can also be tested. Now, genetic testing identifies the carrier status in females and confirms the mutations in newborns. So if genetic testing is done, we can find out if there are any carriers in the females, and if any mutations can be formed in the newborns, that also can be tested, right? Now, what are the treatments of hemophilia? Actually, there is no permanent cure of this, but the treatment helps to manage the symptoms and prevent complications. First and the foremost treatment is clotting factor infusions, that is, replacement therapy is done. So, how the replacement therapy is done? Factor 7 is being infused for hemophilia A, factor 9 infusions for hemophilia B, and it can be given on demand during bleeding, prophylactically, that is regularly, to prevent the bleeding. So they can be given regularly to prevent any type of hemophilia, that is infusions of factor 9 and 8 regarding to which hemophilia they are having, it can be infused. Now, desmopressin, in case of mild hemophilia, it can be used. It stimulates the release of stored factor 8. So their body is having stored factor 8 which is being deficient, but desmopressin is used or injected to stimulate the release of that stored factor in the body. That also helps in the clotting of the blood. Then comes antifibrinolytic drugs, that is tranexamic acid. Tranexamic acid, what is doing? It is preventing the breakdown of clots. So what it will do? It is antifibrinolytic drug. It will when the fibrin is formed, that will prevent the breakdown of clots. The clot will not break down, so it will form as it is, and used in minor bleeding or after dental procedure. This type of antifibrinolytic drugs are used. Now, gene therapy is also used, which aims at to introduce functional copies of defective genes. So what are the defective genes? Those copies they'll make in lab, and they will infuse that by the method of gene therapy. And ongoing research is showing promising results in case of gene therapy. Next comes the supportive care, physical therapy, which prevents the joint damage when they are having that hemarthrosis, that is very painful, internal bleeding in joints and all is happening. Physiotherapy or physical therapy is done to prevent the joint damage, but in these cases we can say that non-steroidal anti-inflammatory drugs are prohibited. Aspirin, ibuprofen, these are the drugs which can worsen bleeding, because these are the we can say these are the blood thinning drugs. If they are taking this kind of drugs, as they don't have any deficiency, or they are having deficiency of clotting factor, their fibrin is not forming properly, if they are taking aspirin and ibuprofen type of medicine, it will cause the hemophilia more worsen, so it will worsen that. So, what are the preventive measures we can take? We can do regular health checkup for hemophilic patients for the clotting levels and all. Low impact exercises like swimming, which reduce the joint stress and all, can be done. Avoid contact sports, that is high risk injury and bleeding can be prevented. Dental care to prevent gum bleeding. Proper dental care should be taken so that your teeth, your gum should be proper and no bleeding happens. Medical alert that helps to generate emergencies. Bracelets are there if you are having any injury, any bleeding. This bracelets will be useful in emergency. So this is all for today's episode. We have spoken each and everything about hemophilia. We have spoken about certain case studies also, in case if you are getting them in your NEET as well as pre-medical exams as well as your NCRT or board exams. So let's please go through that full episode, and please do subscribe to my channel for the upcoming episodes of more interesting autosomal recessive disorder as well as other diseases and other lessons as well. So after this, completing this lesson of diseases and all, we will move on to the molecular biology. We will study about the central dogma of molecular biology and all. So let's move on to the next class and wait for the next class. Till then, get subscribed to the channel and share it with your friends as well. Bye bye, and meet you in the next episode as well. Thank you. Thanks a lot for watching.